Hello and welcome to Virtual Investor Conferences. On behalf of OTC Markets and our co-host, Zacks Small Cap Research, we are very pleased you have joined us for our two-day Life Science Investor Forum. Our first presentation is from Nika Pharmaceuticals. As a reminder, you may submit questions for the presenter in the box to the left of the slides, and they will answer them as many as possible and will follow up directly with any questions that they are not able to get to. You can also view a company's availability for a one-on-one meeting by clicking Book Meeting in the top toolbar. Please note, we are using an AI-generated tool to assist with real-time translations for this speaker. At this point, I'm very pleased to welcome Dimitar Savov, President, CEO, CFO, and Director of Nika Pharmaceuticals, which trades on the OTCQB venture market under the symbol NIKA. Welcome, Dimitar.
Hello, my name is Dimitar Savov, and I am the CEO of Nika Pharmaceuticals, Inc., a pharmaceutical company specializing in the production and distribution of drugs for significant diseases where enhanced and high-quality cellular immune response is of critical importance. The company owns 6 drugs in injection form, 4 technologies for drugs in tablet forms, and 11 dietary supplements, all with strong therapeutic and, in some cases, significant curative properties. 6 of these supplements are already on the market and sold in Bulgaria. The company's main drug in injection form is ITV-1, which has the trade name ImmuneH. ITV-1 underwent a clinical trial at the largest state infectious disease hospital in Sofia, Bulgaria, involving 31 patients with AIDS. The results from the clinical trial showed that all patients' immune cell counts increased on average by 180 per milliliters of blood, which is an extremely significant improvement. Additionally, the viral load in these patients dropped to about 0, reaching undetectable levels, which is below 40 units. Only one patient maintained a small viral load. This exception was due to that patient joining without meeting the trial acceptance criteria and also having a concurrent brain cancer diagnosis. Despite this, the patient still showed improvement both in terms of AIDS symptoms and in relation to the cancer. 20 different opportunistic infections, commonly associated with AIDS, were observed among all trial participants. After 2 rounds of 16 injections, all opportunistic infections were fully resolved in the patients. This is viewed as an outstanding result from the clinical trial. ITV-1 is an antiretroviral protease inhibitor developed with this purpose in mind, but in terms of mechanism of action, it is also a strong immunomodulator. With AIDS, and it is somewhat similar with some cancers as well, but mostly with AIDS, the problem is that as the virus enters the human body, the immune system, specifically T cells, CD3, CD4, CD8, CD19, CD23, does not recognize the threat and fails to become activated. Instead of attacking and destroying the virus, the HIV virus passes through and infects the key CD4 plus T cell, which the virus exclusively targets. It is characteristic that only the virus can replicate and spread through the CD4 cell. Only it has the membrane. Therefore, it is considered that once the virus infects the CD4 cell, it begins to infect other cells as well. Our drug, by its mechanism of action, performs several extremely important functions. First, it acts as a foreign antigen by its very nature. This antigen contains trained immune cells, which, explained in layman's terms, alarm the patient's immune system that it is inactive and that there is a problem, specifically a viral attack on the immune system.
че тя е пасивна, че има проблем, че има вирус, който работи срещу имунната система и ги активира. Активира един
ITV1 activates the body's own immune system, and secondly, adds already trained immune cells, which also support the immune system in destroying the virus and restoring cellular immunity.
на клетъчния имунитет. Тъй като сме
We have tracked the so-called natural killer, NK cells, not only the acquired immunity that works in the blood, but also the CD56 cells that work in the lymph nodes and at the DNA level. The results are extremely good, especially regarding CD56 cells, where there's also an increase of over 180 units in milliliters of blood.
Смята се, че ITV1
Because of this, it can be considered that ITV1 resolves the problem of AIDS, including at the DNA level. This is extremely important as it shows the potential for complete cure of the patient from this significant social disease. Also, outside of the aforementioned clinical trial, we can provide a characteristic example. A 22-year-old woman in an advanced stage of AIDS who underwent 2 courses of treatment with ITV1. After the treatment, she and her husband chose to have children at their own responsibility. They now have 2 kids, a 6-year-old boy and a 4-year-old girl.
Да направят така, да се създадат поколение. Раждат им се 2 дечица. Едното е на 6 годинки вече момче.
Both children, as well as the mother and father, are alive and healthy. They have been repeatedly tested and do not have HIV and are in excellent health. This gives us further reason to believe with even greater confidence that ITV1 will be something of great importance in the fight against AIDS. The reason why ITV1 will have an important place in the fight against AIDS is that current protease inhibitors only lower the amount of virus in the blood, but the available drugs do not act at the DNA level. This means that after 10 to 15 or up to 20 years, the patient may still die, despite living somewhat more comfortably during this time by suppressing viral load in the blood. ITV1 is compatible with current antiretroviral therapies, so it can be administered together or separately, providing physicians with an even better option for future treatment decisions. ITV1, in our opinion, will be indispensable for addressing the severe challenge of AIDS.
Болестта СПИН.
Additionally, in its mechanism of action, ITV1 does something extremely important. We know that an individual is born with NK cells, natural killer cells. But after birth, the acquired immune system is developed, the so-called T cells, CD3, CD4, CD8, CD19, CD23, that function only in the blood, while NK cells are active at the DNA level and in the lymph nodes. The acquired immune system after birth is built based on the thymus gland. However, it is documented that after the age of 25, the thymus ceases to produce new cells, and the process slows down. People generally live with the immune capacity developed by this age.
И обикновено пациентите хората живеят с това, което са набавили до около тази възраст.
Efforts worldwide to activate the immune system by transplantation of stem cells are quite difficult and risky in principle, but the intent is to stimulate the bone marrow to begin producing new immune cells. We have clear reasons to consider that ITV1 has a strong effect, leading to said increase on average of 180 immune cells in milliliters of blood. Said immune cells, specifically lymphocytes, will continue to be produced at increasing levels because ITV1 acts as a depot. Its effects does not stop after the administration period of the injections. Cell accumulation continues, meaning that with ITV1, we stimulate the patient's bone marrow, which starts producing more lymphocytes and immune cells. This significantly increases the person's immune system to an extremely high degree, enabling them to address any problem. ITV1 has been tested on multiple volunteers with cancer, including various types of cancer believed to be of viral or bacterial origin, primarily prostate cancer, uterine cancer, colon cancer, pancreas cancer, and leukemia, among others. The best results are observed, of course, in cases of pancreas cancer, uterine cancer, and prostate cancer.
И левкемия, нали, но и на други ракови заболявания. Най-добър ефект разбира се, върху панкреас, рак на матка и рак на простата. Смята се,
It is believed that with these cancers, the causative agent is a virus that the body's own immune system does not attack, allowing the disease to spread and resulting in the formation of tumor markers and other consequences.
разпространението на болестта и възникването вече на туморните маркери и на всичко останало.
The strength of ITV1 is that it attacks the underlying cause, targeting viruses and bacteria, and by eliminating the cause, stimulates cellular immunity to address the disease. For us, this is the correct approach, as it does not further burden the patient's immune system as chemotherapy does. The success of chemotherapy, as is well known, is limited and questionable.
Изключително минимален, нали, да не кажем, нали, доста спорен.
ITV1 gives the patient's own organism the ability to recover and to deal with diseases such as we mentioned, prostate cancer, cervical cancer, pancreatic cancer, colon cancer, and leukemia. In stages 1 and 2 cancer, those patients who were treated with ITV1, the success rate is over 80%.
Тези пациенти, които сме тествали за рак, успеваемостта е някъде над 80%.
In stages 3 and 4, which are the final terminal stages, the success rate still exceeds 50%, especially in cases with prostate and cervical cancers, cervical cancer often being associated with papillomavirus. ITV1 has also shown effectiveness for patients with chronic hepatitis B. I can mention 2 cases, one with indications of cirrhosis due to hepatitis B in very advanced stages.
Болни от хепатит хронични Б и С. Б и С мога 2 случая да кажа, основно.
Even in advanced stages of hepatitis, which we know are usually incurable, after 2 courses of ITV1, the patient's cirrhosis was completely cured, the immune system was restored, and the hepatitis B virus was cleared.
Цирозата напълно излекувана и имунна система напълно възстановена, вирусът на хепатит.
The same occurred with a patient suffering from chronic hepatitis C in an advanced stage, not yet cirrhotic, but with significant liver pain. After 2 courses of treatment, the pain disappeared and the patient recovered. More than 9 years have passed and both patients are in excellent health.
Вече повече от 9 години двамата пациенти са в изключително добро здравословно състояние.
ITV1 was also administered to a patient at the Military Medical Academy in Sofia, one of the largest hospitals there, who had advanced tuberculosis. Despite intensive attempts to save the patient with all available treatments, they were draining 1.5 liters of pus from the lungs and had discharged the patient with the worst possible prognosis for survival. After 2 courses of ITV1, the patient recovered after the first cycle and was fully cured of this life-threatening disease after the second treatment cycle, whilst the bacterium of tuberculosis was also eliminated. The patient has lived in good health for more than 7 years now, leading a normal life with heightened physical activity after the treatment. We can also list several cases of tests in a veterinary clinic on domestic animals such as dogs and cats. For example, a dog previously operated on for uterine cancer, sometime after the surgery experienced recurrence and metastasis, clusters throughout the abdomen. After only 3 injections of ITV1 administered on 3 consecutive days, by the 30th day, the dog had fully recovered with both the metastases and tumors no longer present. You can clearly see the significant positive change in appearance. The coat is shiny and healthy. There were several cases with dogs with canine distemper, the deadly disease affecting animals, specifically dogs, in which the dogs also received only 3 injections, with ITV1 serving as a life-saving treatment for this fatal disease. ITV1 has also been tested in cats infected with coronavirus and feline calicivirus, the treatment of both types of diseases showed good results. This is important because pets are part of our daily lives and families. We become attached to them and love them, so they deserve the same care and attention as people.
Харесваме ги, обичаме и те заслужават същото внимание, нали? Такова каквото правим и на хората.
Each ITV1 injection of 3 milliliters contains about 21 milligrams of active substance, between 4 and 8 milligrams per milliliter, very well synthesized, and is administered deeply intramuscularly in the gluteal region. Typically, 2 courses of 16 injections are sufficient for treatment of the diseases in humans previously mentioned.
Съответно, 2 курса по 16 инжекции са достатъчни за тези болести, които изборихме.
Nika Pharmaceuticals partner, Nika Europe, purchased a very nice and ready-made building located in Novi Han, about 15 kilometers outside the city of Sofia, capital of Bulgaria, which has provided the opportunity to shorten the time to build a factory. The building consists of a large halls, along with an administrative section and its own infrastructure, including full utility and energy systems.
Цяла инфраструктура, нали, съответно енергийна и всякаква система.
At present, Nika Europe is building a factory capable of producing 3.5 million treatment sets. The production building valuation exceeds $2 million US. Currently, this new factory is expected to begin production and be operational in the second half of 2025. Nika has so far signed distribution contracts with 6 countries for the sale of ITV1, Nigeria, the United Arab Emirates, Iraq, Syria, Jordan, and Ukraine.
Това са Нигерия, Обединени арабски емирства, Ирак, Сирия, Йордания и Украина. Те ще закупуват
The distribution partners in these countries will purchase the medicine from Nika at 1,980 euros per set, providing Nika with an estimated profit of more than $1,100 per set. With 3.5 million treatment sets produced each year, Nika Pharmaceuticals will generate over $4 billion in profit, an impressive figure.
за Nика, нали, Pharmaceutical, което е един изключително силен ефект, тъй като в момента
Currently, over 17% of people worldwide are estimated, according to data from the World Health Organization, to suffer from various infectious diseases, including AIDS, some forms of cancer, hepatitis, rheumatoid arthritis, and others.
Спин, рак, хепатит, нали, съответно ревматоиден артрит и друго. Това означава, че
This means that more than 1.4 billion people are in need of affordable medicines. For this reason, Nika will immediately begin construction of a second factory in 2026, with a production capacity of over 15 million sets annually. Nika then plans to partner for both production and distribution with major companies in different regions, including Europe and North America, to allow for even wider production, so the medicine can reach more people. Many of these people's lives are at risk, especially those with cancer, who cannot afford to wait. For some, the final stage of the disease can last between 6 months and a year. In 2026, Nika also plans to build a new facility for the production of drugs in tablet form and a factory for dietary supplements. At this stage, we are producing our dietary supplements through a contract manufacturer that meets all European Commission standards and the requirements of the Food and Drug Administration of the United States of America. Currently, we are also pursuing strategic partnerships, but discussions of details about them will not be made public until said potential partnerships are finalized and agreements are reached. The advantages of ITV1 are that, unlike other drugs, it does not have side effects. First, it is easy to administer. Anyone can purchase 2 sets of 16 injections without being hospitalized, and the treatment can be administered at home. Patients will be able to have 2 injections per week delivered directly at home, 1 per day when an application is scheduled. It is an exceptionally useful medication which has been tested on people who are of advanced age just for immune systems, with the goal of improving their general immunity.
на система на хора, с които са с възрастни така на определена възраст. Аз лично
I have
също съм
personally administered it to
тествал
myself
себе
and to
си
relatives,
животни върху
and there has been
организми,
significant recovery of the immune system, especially for those predisposed to illness, particularly in winter. After 1 or 2 courses of ITV1 over 5 or 6 years, patients stopped experiencing frequent illnesses. It has generally provided protection against various types of influenza, as well as viral and bacterial diseases.
което е било по-зачестено от различни видове предпазни, от различни видове грипови, различни видове вирусни и бактериални заболявания.
As I mentioned, it is a medication that is not only quite useful, but also has no side effects, which is extremely important because, as an example, the adverse effects, especially in chemotherapy, being an immunosuppressive agent, attacks not only the disease cells and tumor markers, but also destroys the immune system.
Тъй като химията е супресивно средство, тя атакува както атакува болните клетки, нали, съответно туморните маркери, но тя атакува и имунната система и унищожава, нали, съответно. И за нас това е
In our view, this is an entirely erroneous approach. At this stage, we believe that the future of treatment is with drugs that work in similar ways and come from natural sources, such as the biological medicine ITV1.
Механизъм и действие и происход, както е естествено лекарства биологични като ITV1.
Now, there are several questions that viewers have asked, which I would like to address. One important question is, do you think the current share price reflects the actual value of the company? This is a very important question. At this stage, it can be considered that the shares are significantly undervalued for the simple reason that Nika Pharmaceuticals is currently focused on building a manufacturing facility. We are only publishing updates and information once certain milestones have been achieved. In other words, we have not actively promoted the company so far. The company is not yet well known, but this is not of major importance because even at this state of the shares, Nika's investment program can be considered secured. Once the factory begins production and we report our first significant financial results, showing solid profits and responsible economic and financial management of said profits, the value of the shares will start to reflect the company's true worth.
На добра печалба и на добро икономическо и финансово управление на тези печалби.
Which means that at that point, the profits can then be allocated to additional investment, reserves, dividends, and so forth. So, in my opinion, at this stage, the shares are significantly undervalued, as I said, because we simply have left this aspect of popularizing the company in the background. We are not focused on share sales at this stage.
На този етап.
For the next question, what is Nika's philosophy? Nika's philosophy is to concentrate solely on medicines that are exceptionally beneficial to people and are without side effects, which can be provided in a timely manner and, what is of utmost importance, to lower the cost of these medicines. As I mentioned, currently, one treatment for AIDS on average costs $35,000 per year, or 35,000 euros depending on location, and is used for 15 years, 10 to 20, depending on the patient's lifespan. Yet, unfortunately, people still die. The total treatment costs between $300,000 and $400,000, which places a heavy burden on healthcare systems and, on the other hand, makes treatment difficult to access for people. Nika Pharmaceuticals has already signed agreements for distribution at a wholesale price of 1,980 euros per unit, with the final retail price reaching 3,300 euros per set. This is about 6,600 euros for a complete treatment with ITV1, a price that is 20 to 30 times lower than the current cost of available treatments for AIDS. This does not even include cancer treatments, which now start at $50,000 to $60,000 in financially weaker countries and rise to $130,000 to $150,000 in the United States, upwards of $100,000 in Europe, and upward of around $80,000 in Switzerland. Therefore, our philosophy is and will remain the same. We focus on providing affordable, accessible, and highly effective medicines without side effects. What other questions are there? Why are you in a hurry to start construction of a second factory? Regarding the construction of a second factory, as I previously mentioned, we are pursuing this to ensure timely access for patients. Cancer progression, especially in conditions like leukemia, often happens quickly, sometimes within months and usually in less than a year, reaching from stage 1 to the advanced stage 4 at a very rapid rate. Globally, for example, in 2022, cancer accounted for about 15 to 16% of deaths. Likewise, hepatitis is a very severe issue, but cancer more so, because in cases of cancer, patients cannot afford to wait. Expediting the new factory is crucial to save as many lives as possible. From a humanitarian perspective, parts of the profits will be directed towards supporting social initiatives, which Nika will take upon as additional activity that will be an important part of Nika's mission. I would also like to thank everyone who were part of this presentation live or will watch later. I hope that in these brief minutes, I managed to provide you with concise and comprehensive information about Nika and the work we do. We are looking forward to you contacting us with any questions you may have. We are always ready to respond, whether you are potential investors or others interested in contributing. We consider that investing in Nika supports an important and humane cause while also helping establish a sustainable business that could have a significant positive impact on other sectors as well. Finally, enabling the US company Nika through Nika Europe to have global presence into the European, Asian, and African markets, which are extremely important markets. I wish you and your families health, success in all your endeavors, and may God bless you.